Thanks for joining us. Today, we're here to help provide clear answers to your Medicare questions and talk about Medicare Advantage plans from UnitedHealthcare, chosen by more Americans than any other Medicare Advantage plans. A lot of this information can be found in the Medicare Advantage Clarity Guide. Feel free to page through as we go or ask a local licensed sales agent for a copy when we're done. If you have questions afterward, a UnitedHealthcare licensed sales agent can help you understand all your coverage options so you can enroll in a plan that meets your specific needs. You can rely on our UnitedHealthcare licensed sales agent to help make finding the right UnitedHealthcare plan simple. With our Right Plan promise and over 45 years serving Medicare beneficiaries, we can help you choose a plan with confidence. Let's get started. Medicare, often called Original Medicare, is a federal government health program that most American citizens qualify for when they turn 65. It has two parts. Part A helps pay for hospital stays and inpatient care, and Part B helps pay for doctor and provider visits as well as outpatient care. But it doesn't cover everything, like prescription drugs, routine dental, vision, and hearing coverage. Luckily, there are two ways to get more coverage. These are explained on page 4 of the Clarity Guide. One option is to add additional coverage to Original Medicare. Medicare supplement plans are offered by private insurance companies to help pay for some or all the costs not covered by Original Medicare. You can also add a Medicare Part D plan to help pay for prescription drugs. The other option is to enroll in a Medicare Advantage plan. These plans, also offered by private insurance companies, provide all the benefits of Original Medicare and additional benefits, which may include prescription drug coverage, dental, vision, and hearing coverage, and fitness programs, all in one plan. Remember, when it comes to Medicare coverage, you have choices. The type of plan you choose will depend on the things that are most important to you. If you are looking for lower monthly premiums or benefits not provided by Original Medicare, you may want to choose a Medicare Advantage plan. If you are looking for nationwide access to any provider that accepts Medicare, you may want to choose a Medicare Supplement plan. If you are just looking to add prescription drug coverage to Original Medicare or a Medicare Supplement plan, you may want to choose a standalone Medicare Part D plan. If you already receive Medicaid and are looking for additional Medicare benefits, you may want to enroll in a dual special needs plan. And if you have a chronic condition, such as diabetes, cardiovascular disease, and/or chronic heart failure, you may want to choose a chronic special needs plan. Remember, UnitedHealthcare offers plans designed for all budgets, stages, and ages of Medicare, and a sales agent can help you find the plan that best fits your needs. Now, whether you're enrolling in Original Medicare, a Medicare Advantage plan, or a standalone prescription drug plan, there are several clearly defined times for you to sign up. Page 6 of the Clarity Guide has all the details, but here's a quick overview. For most people, the first time you can sign up is called your initial enrollment period. This period is 7 months long and includes the month of your 65th birthday, plus the 3 months before and the 3 months after. If you miss your initial enrollment period, you will have another opportunity to enroll during the General Enrollment Period, or GEP, which runs January 1st to March 31st each year, though you may pay a monthly late enrollment penalty if you do not qualify for a special enrollment period. During this time, you can enroll in Medicare Part A, Medicare Part B, or both. You can also decide to enroll in a Medicare Advantage plan, Part C, with or without prescription drug coverage, Part D, or you can choose a standalone prescription drug plan. Although you're not required to enroll in Part D, there may be a penalty for each month you delay your enrollment after your initial enrollment period. After your initial enrollment period, each year you'll have an annual enrollment period, starting on October 15th and ending on December 7th, when you can add, drop, or switch your Medicare coverage. If you choose to enroll in a Medicare Advantage plan, you can make changes during Medicare Advantage Open Enrollment Period, which lasts from January 1st through March 31st. At this time, you can disenroll from your current plan and make one switch to a different Medicare Advantage plan, or go back to Original Medicare. And if you experience a qualifying life event, there is a special enrollment period, which lets you change your Medicare coverage outside of your initial enrollment period or the annual enrollment period. Talk to your agent to learn more about qualifying for a special enrollment period. Again, you can find more information about Medicare eligibility and enrollment on pages 6 and 7 of your Clarity Guide. One of the most important benefits of Medicare Advantage is that most plans include prescription drug coverage, which is not included with Original Medicare. Starting in 2025, the Medicare Part D prescription drug program is changing. These industry-wide changes are designed to lower total prescription drug costs by removing the coverage gap, also known as the donut hole, and lowering the out-of-pocket maximum. This means there will only be 3 Part D prescription drug coverage stages: deductible, depending on your plan, initial coverage, and catastrophic coverage. The first stage is the annual deductible stage, where you pay 100% of your drug costs until you reach the plan deductible. This amount will vary by plan. Next is the initial coverage stage, during which your plan pays most of the cost and you pay a copay or coinsurance. The amount also varies by plan and depends on the drug being prescribed. You'll remain in this stage until your total drug costs reach $2,000 for the year. Once you hit the $2,000 out-of-pocket maximum, including any amount paid toward your deductible, you'll move straight into catastrophic coverage, which means you'll pay $0 for Part D covered prescription drugs for the rest of the plan year. For more details, see page 8 of the Clarity Guide. You'll also notice that most drug plans use what's called a tiered formulary to group covered drugs according to cost. Health plans organize medications into 5 tiers, with lower tier drugs typically costing less than higher tier drugs. Deductibles may also vary by tier, so ask your agent to help you identify the tiers your medications are in. If you're looking for more detailed information about the drug payment stages, as well as a glossary of key terms, read through pages 8 and 9 of the Clarity Guide. Now that we've covered the basics, let's go over some important facts about Medicare Advantage plans. As you think about whether a Medicare Advantage plan is right for you, here are some important things to be aware of. Medicare Advantage plans must cover the same services as Original Medicare and may offer additional benefits. Adding a Medicare Advantage plan could affect or cancel your current coverage. All Medicare Advantage plans offer the same protections as Original Medicare. Medicare Supplement insurance plans and Medicare Advantage plans are not the same. If you do choose a Medicare Advantage plan, there are certain steps you can take to protect yourself. You must continue to pay your Part B premium. Financial assistance may be available depending on your situation. If you are late to enroll in Part D prescription drug coverage, you may pay a penalty. Finally, as you move forward, here are some additional reminders. Using network providers may save you money. Always present your UnitedHealthcare member ID card for covered services and prescriptions. Because all Medicare Advantage plans include an out-of-pocket maximum, you have a built-in safety net. If you'd like more detailed information around Medicare Advantage plans, as well as where to find additional resources, please see pages 10 and 11 of the Clarity Guide. Remember, when it comes to Medicare, one size does not fit all. A UnitedHealthcare licensed sales agent is trained to provide personalized support to help you choose a plan with confidence. They can help you see if your current doctors are in network, make sure your prescriptions are covered, see if you qualify for financial assistance, and so much more. Because we know you're not done dreaming, planning, and doing. From choosing your plan, to using your plan, to enjoying your whole life ahead, you can rely on UnitedHealthcare, America's most chosen Medicare Advantage brand, to help you find the right plan for your needs. Thanks for watching.